All right, so welcome, ladies and gentlemen, to our first tutorial on microbiology. All right, so let's begin. So we are having what? They say quite often the cause of secondary immunodeficiency is an infection involvement. When the causative agent propagates directly in the cells of the immune system, it destroys it. The following diseases are characterized by, so look at it, they are talking about what? Secondary immunodeficiency infection. Secondary immunodeficiency. Again, when we're talking about the immune deficiency, we are normally referring to what? The T cells, basically, or the lymphocytes. We're referring to the T cells because they are the cells for immunity. They are the cells of immunity. So which amount of these attacks the T cells? That's what the question is all about. Which of these cells, these diseases attack T cells? Attack T cells to give us the immune deficiency. And over here, you are thinking of what? Infectious mononucleosis and AIDS. Infectious mononucleosis and AIDS. And in infectious mononucleosis, it attacks CD8. CD8 plus. It attacks CD8 plus. And then in AIDS, it attacked CD4 plus. CD4 plus. CD4 plus. Okay, so these are basically the cells, the specific cells they target, and all of these are all T cells. They are all T cells. So your answer is what? C. Infectious mononucleosis and then AIDS. It is planned to use the territory of an old cattle burial ground, which is not used for more than 50 years for building houses. But ground analysis revealed the presence of pathogen of the very dangerous illness. Guys, look, you ask yourself, what kind of pathogen can last under the soil or can be inside the soil for more than 50 years and it is still causing what? Dangerous illnesses. That is the question all about. And over here, you are thinking of what? An anthrax. 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 So it is caused by the Bacillus anthracis. Bacillus anthracis. So your answer here is what? It's anthrax. And these anthrax are able to live in the soil for so many years. They're able to live in the soil for so many years. Over here, we are looking at what? At anthracis or Bacillus anthracis. Bacillus anthracis. All right. So your answer is A. We have from the nasopharynx a 5-year-old child. Of a 5-year-old child, it was excreted a microorganism which is identical to Corynebacterium diphtheria dose according to morphological and biological science, biochemical science. Now, microorganism does not produce exotoxin. It doesn't produce any toxin. As a result of what process can this microorganism become toxigenic? At what process can this microorganism become toxigenic? Become toxigenic. So what I'm trying to say is that, first of all, it's not producing any toxins, or it is not producing any exotoxin or any harmful substances. But the question is, at what process can this microorganism become toxic to the human body or to the organism it is what? Infecting? That's the question. And over here, we've done something like this, I think in one of our lectures. I've gotten the exact one, but here we are thinking about what? Phage conversion. Phage conversion. Phage conversion. And phage, kindly mute your microphone. Dr. Kwesi, thank you. All right. So we have what? Phage conversion, whereby microorganism that does not produce any endotoxin begin to become what? Toxigenic. Begin to become toxigenic. Begin to become toxigenic. So over here, you are thinking of phage conversion. Phage conversion. Again, it occurs when a bacteria, which is on the normal day, is not causing any infection or any toxicity, but you are trying to still or make it toxigenic. So that one you do what we call the phage conversion. That's what it's convert. So you're converting it from non-toxic state to a toxic state. So that will help you to remember it. So we are talking about phage conversion. Phage conversion. So your answer is what? Is B. Phage conversion. All right. While studying a microslide obtained from a puncture of a regional lymph node and sustained, Paul was asking the last time about some of these stainings. You see, there's a staining here, Romanovsky Gimsa or Gimsa, by a physician revealed some light pink thin microorganisms with 1 to 14 regular spiral coils and pointed ends, up to 10 to 13 micrometer long. This might be the causative agent of the following disease. Unfortunately, with this kind of question, if you don't know it or you're not familiar with it, the probability that you're going to get it wrong will be high. The probability that you're going to get it wrong will be high because apart from the fact that these plants are having regular spiral coils, which of course you hardly see some of these microorganisms, you might get this wrong. So if you don't take care, you might be thinking of this as what? As leptospirosis. That's why I said if this question is not familiar to you, you will get this question wrong. You will get this question wrong. Some people will say, oh, but they're having a spiral growth, spiral coils. So let's go in for leptospirosis. But no, this is still syphilis. This is still syphilis. And I know I've mentioned the forms of syphilis to you guys, where we have the Guma cells, the syphilitic iotitis, and so on and so forth. I've told you guys that, and again, syphilis are, how do I put it? They are painless sores that sometimes you find it around the genitals. But in this question, they didn't even give a lot of information about this syphilis. They only told us the characteristics of the syphilis in terms of structure. And something like that is kind of difficult to know your answer. So again, put this in your head that even though they are having 12 to 14 regular spiral coils, your answer is still syphilis rather than leptospirosis. So here we'll go in for what? Syphilis. All right. What do we have here? A sanitary bacteriological research on a water by the membrane filter method revealed 2 colonies. We'll write this down. 2 colonies through which 500 ml of analyzed water were passed. Calculate the color index, and then the color titer. Color index, and then the color titer. So first of all, we need to understand what color index is. What color index, not color. Color index has to do with HB or hemoglobin. This is coli index, that's E. coli, or coliform index. So what are these two meant for? So the coli index and then the color titer are used to rate the purity of water, the purity of soil, and the purity of air based on the account or based on the number of fecal bacteria, based on the amount of fecal bacteria by testing for coliforms. So if you take a sample of soil or air or water, for instance, you are going to determine the amount of these coliform bodies inside that substance or inside that medium. And usually what we normally use as a coliform is the E. coli, the Escherichia coli. That is what we use as a landmark or as a means for measuring the purity of water, soil, and air. Great. So what then is a color titer? A coli titer is the smallest amount of water where 1 E. coli is present. Again, the coli titer is the smallest amount of water where 1 E. coli is present. So if you take a sample of water, let's say a cup of water, if you measure it and there is 1 E. coli present, that is the coli titer. Great. Now, what about the color index? The coli index. The coli index is the amount of E. coli in 1 liter of water. They look similar, but you must understand the differences. A coli index is the amount of E. coli in 1 liter of water. Coli titer is the smallest amount of water where 1 E. coli is present. Two different things. So, for example, assuming this is my container, or this is my smallest amount of water inside this container. So, for this, inside this container, I have 1 E. coli present. Irrespective of the volume of water I have, or it is the smallest one, this is called the coli titer. Coli index is when, if this is 1 liter of water, the amount of E. coli in 1 liter of water, that is coli index or coli index. So they are two different things. Now look at this question. So now let's calculate the coli index, and the coli titer. Now they're saying that this person is having what? 2 red colonies through 500 mils. 2 red colonies in 500 mils. What it means is that 2 E. coli CO. 2 E. coli is equal to what? 500 mils. That's what it means. Or you can see 2 E. coli in 500 what? Mils. But we are looking for 1 E. coli. We are looking for what? 1 E. coli. Don't forget I said coli titer is 1 E. coli in the smallest volume of what? Of water. In the smallest amount of what? Water. Where we can find just 1 E. coli. Just 1 E. coli. So if in 2 E. coli we are having 500 mils, what about 1? Because we're looking for what? So 1 E. coli will be equal to what? 500 mils divided by what? 2. As simple as that. And what is your answer? 250 mils. That gives you 250 mils. So for every 1 E. coli, we have what? So this is the smallest volume. So we can have 1 E. coli is present in what? In 250 mils of water. So this is the coli titer. Now again, let's look for the coli index. The coli index. And we said the coli index is the amount of what? E. coli. The amount of E. coli in what? In 1 liter. The amount of E. coli present in 1 liter of water. In 1 liter of water. And 1 liter of water is the same as what? 1,000 mils. This is the same as what? 1,000 mils. 1,000 mils. So 1 liter is the same as what? 1,000 mils. 1,000 mils. However, we are having 2 liters. We are having 2 E. coli. 2 E. coli in 500 mils. In 500 what? Mils. We have 2 E. coli in 500 mils. But then we are looking for the amount of E. coli in 1,000. How many E. coli will make what? 1,000. So if 2 E. coli, we can find it in 500 mils, then how much will make 1,000? Of course, you have to double it. So that means that 4 E. coli will be equal to what? 1,000 mils. Again, it means that if you can see 2 E. coli in 500 mils, Then with 4 coli, you will see 1,000 mils. And that is what we're actually looking for in the coli index. So what it means is that this 4 here will now be what? The coli index. The coli index. So in a nutshell, what it means is that the coli index is 4, whilst the coli titer is what? 250. Whilst the coli titer is 250. As simple as ABCD. So again, over here, what is your answer? Your answer will be what? Will be E, 4 and then 250, where 4 represent the coli index and then 250 represent the coli titer. Coli titer. So that is just by the way. So the answer is E. I have to take a conclusion for you guys so that in case Krok bring different values, you wouldn't be found wanting. You wouldn't be found wanting. Now look at this question. While examining a patient on otolaryngologists, notice that there's hyperemia, significantly edematous tonsils with grayish film upon them. Anytime you see a grayish film or fibrins, then you're thinking of what type of inflammation? Of course, fibrinoid type of inflammation. You are thinking of a fibrinoid type of inflammation. And again, when I said if you're thinking of fibrinoid type of inflammation, there are 2 types. We have what? Croup and we have what? Diphtheric. We have croup and then we have diphtheric. In croup, you can remove the substance on it without any bleeding. But with diphtheric, if you are moving it, there is a problem. There will be what? A problem. Great. So now let's look at the question. Microscopical examination of this film revealed some gram-positive bacilli placed at the angle with each other. What disease might be suspected? What disease might be suspected? Yes, although they were not talking about the type of fibrinoid inflammation, this will still be what? Diphtheria. This will still be diphtheria. 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 So over here, you are thinking of what? Diphtheria. Diphtheria. Because diphtheria are also what? Gram-positive. They are often like a clap-shaped rods. And of course, they also arranged at they are arranged in V's and L shape. In V, they are arranged in V and in L shapes. V and L shapes. V and L shapes. So basically, that is it. And again, let me add this one to it. You can write it down in diphtheria too. How will you diagnose diphtheria, or which media will you use for diphtheria? We call it tellurate agar. TELLURITE tellurite agar. Tellurite agar. Agar. Then you can also use Loeffler. That's LOFFLER. Loeffler medium. So these are the media that we can use for diagnosis of what? Diphtheria. I'm saying this because we might meet it. We might meet it. And when we meet it, you shouldn't be found wanting. So here, your answer is what? Diphtheria. But again, since it is fibrinoid, either it is what? Croup or diphtheria. So this one will go for diphtheria. All right. A patient with vomiting, dizziness, sensation of double vision, difficult swallowing was admitted to the hospital. The doctor is suspecting botulism. Botulism. Again, where do we get botulism from? From canned foods. Canned food or food that have been stored for some time. These food substances are, if you eat these food substances, you are at high risk of contracting what? Botulism, or being infected with botulism. So how do we investigate this kind of microorganism? Of course, you do your biological test and then bacteriological test. So your answer would be what? Biological and bacteriological. Bacteriological. So basically, that is it. They actually mean the same thing, because biological tests you're trying to look at the, how do I even put it? It's the same as looking at the biology or how the substance reacts to some staining. To some staining. And then with the bacteriological, you are looking at the structure of it. The structure of it. So over here, you're going for A, for A, for A, for A. And again, you know that in botulism, they have what we call, or their appearance. First of all, they are gram-positive species. Then their appearance resemble the tennis racket, or drumsticks, That is how they appear. They appear like the tennis racket or drumsticks. So please write these things down. All right. A man who was bitten by an unknown dog applied to the surgeon. Wide ragged wounds were localized on the face. What curative prophylactic aid should be given to prevent rabies? This is rabies. So you do what? You do vaccination. Because first of all, we don't know whether the dog was vaccinated or has been vaccinated or not. So what do? You do your what? Vaccination against what? Rabies. Vaccination against what? Rabies. What do? You start with immunization with rabies vaccine. All right. A patient with clinical signs of primary immunodeficiency has functionally disturbed mechanism of antigen presentation to the immunocompetent cells. What cells are likely to have structural defect? What cells? So first of all, they're looking at what? Antigen presenting cells. And then these cells, they sort of present the antigen to the cells to digest or to kill. They present the cell to the immune system to kill. So what are some of these antigen presenting cells? Not all cells are antigen presenting. So please write this down. The antigen presenting cells include dendritic cells. They include dendrites, so dendritic cells. Then we have macrophages. Then we have Langerhans cells. Langerhans, Langerhans. Langerhans cells. Sometimes you can see B cells. B cells. However, macrophages represent a very key target in HIV patients. It is the key target in HIV patients. And of course, before don't get it twisted again, I'm referring to what? Antigen presenting cells. T cells are not antigen presenting cells. So don't confuse what I've just said, like macrophages are the target. Of course, we know that the cells that are target are the T lymphocyte or are the T cells, that are the T helper cells. However, when it comes to the antigen presenting cells, we are dealing with what? Macrophages. And inside the blood, we call it monocyte. Inside tissues, we call it what? Macrophage. So here, we are looking at what? At macrophages and monocyte. All right. A patient with complaints of a 3-day-long fever, general weakness, loss of appetite, came to visit the infectionist. The doctor suspected enteric fever. How will you diagnose this patient, or how are you going to get your confirmation? Now, when they say enteric fever, they are referring to what? Typhoid fever. And again, in typhoid fever, it is caused by what? Salmonella. It is caused by Salmonella. And we have Salmonella typhi and we have Salmonella paratyphi. Salmonella typhi and Salmonella what? Paratyphi. And usually, what we do is that we do what we call a withdrawal test. We do what we call withdrawal test. WIDAL. We do what we call what? Withdrawal test. These withdrawal tests will tell us that whether there is what? Infection caused by the typhoid or not. It will show positive or negative. That is just how it is. However, if you want to know the sensitivity, because sometimes we've had a lot of patients whereby when they come and then we give them Cipro. Actually, Cipro is one of the drugs that we use in the treatment of typhoid fever. When we give them ciprofloxacin, they go and come back that they are still having the same symptoms. So usually we order blood culture. We order what? Blood culture. And this blood culture helps us to determine the exact drug to give to this patient. Because some of these Salmonella, they are resistant to the drugs called the Cipro. They are what? Resistant. So if you want to know the exact drug, you do what? Blood culture. And in the blood culture, you will know there's drugs that are sensitive or that will be sensitive to this microorganism. So here, of course, there's no withdrawal. So definitely we're going for what? For our blood culture. Blood culture. Blood culture. All right. A consumptive patient has an open pulmonary form of disease. Choose what sputum staining should be selected for finding out Tuberculobacillus. 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 So simply put, tuberculosis. Simply put, tuberculosis. So what test will you do for tuberculosis? And the test we do for tuberculosis, we call it what? Acid fast test. Acid fast test. Acid AFT. AFT. If you have been in the world before, you understand what means AFT. So AFT means what? Acid fast test. Acid fast test. And this acid fast test also means what? Zilnelson stain. Zilnelson stain. Zilnelson Nelson stain. It means the same thing. Zilnelson stain. So this is the same as what? Acid fast test or acid fast stain. Acid fast stain. It is used for the diagnosis of what? Tuberculosis. For tuberculosis or mycobacteria. So here you are looking at what? D. You are looking at what? D. During surgical operation, a blood transfusion was made. Please underline blood transfusion. The blood must be checked to find antigens of some diseases. What disease is expected to be found? What it means is that among all these viruses, which one of them is transferred by blood? And your answer is what? Hepatitis B. Hepatitis A and hepatitis E are fecal oral. They are fecal oral. Even adenovirus and enteroviruses. But hepatitis B is by what? Blood or fluid. You get it through blood or fluid. So you're looking at what? Hepatitis B. Hepatitis B. Hepatitis B. So your answer is what? Is C. Hepatitis B. All right. A 42-year-old man who has been injured in a car accident is brought to the emergency room. His blood alcohol level on admission is 250 milligram per deciliter. Hospital records show a prior hospitalization of alcohol-related seizures. So that means that this person has been abusing what? Alcohol. His wife confirms that he has been drinking heavily for 3 weeks. What treatment should be given to the patient if he goes into withdrawal? And again, we did I think under biochemistry or under pharmacology, we talk about what? Withdrawal syndrome or withdrawal symptoms, whereby cessation of the drug leads to what? Psychological problems, or it leads to agitations and so on and so forth. So over here, what is the drug of choice for alcohol withdrawal? And your answer is what? Diazepam. Your answer is what? Diazepam. 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 So here you are looking at what? At A. Diazepam. Diazepam. All right. We have a patient who came to the doctor because of his infertility, was administered to make tests for toxoplasmosis and chronic gonorrhea. Toxoplasmosis and chronic gonorrhea. Which reactions should be performed to reveal latent toxoplasmosis and chronic gonorrhea of the patient? Which test should be done? And over here, you are looking at what? Complement fixation test. You are looking at a complement fixation test. A complement fixation test. Why am I saying so? A complement fixation test is a test that is used to detect the presence of either a specific antibody or a specific antigen in a patient's serum. Again, complement fixation test, it is used to determine the specific what? Either a specific antibody or a specific what? Antigen. So look at it over here. Which reaction should be performed to reveal latent toxoplasmosis and chronic gonorrhea? So we're either looking at what? A specific antibody against toxoplasmosis and against gonorrhea, or a specific what? Antigen for toxoplasmosis and chronic gonorrhea. And that will help us to know what we are what? Looking for, or what we are doing. And another name for this, of course, is the CFT. Is the CFT. That's what complement fixation test. CFT, complement fixation test, or the writer's complement fixation test. They all mean the same thing. They all mean the same thing. Again, what are you looking for? You are looking for a specific antibody and a specific what? Antigen. Okay. So the answer is A. And again, it is basically used for toxoplasmosis and gonorrhea as well. An bacteriological examination of a rinsing water of the patient with food poisoning, the pure bacteria culture was inoculated with the following properties. We have gram-negative motile bacillus in the endo environment, grows like achromic colony. Achromic colony. Representative of what genus has caused this illness. Has caused this illness. Again, you can write this thing down. You can write these things down. Both endoagar, okay, endoagar, and then EMB. EMB. When I say EMB, I'm referring to what? Eosin methylene blue agar. Eosin methylene blue agar. These are selective stain for gram-negative bacteria. They are selective stain for gram-negative bacteria. Gram-negative bacteria. Okay. Okay, good. So again, they provide a color indicator distinguishing between organisms that ferment lactose, example E. coli, and those that do not, example Salmonella. I repeat, they help us to differentiate between what? Organisms that ferment lactose. It ferment lactose. Example is E. coli. Then the ones that do not, example is Salmonella. 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 So again, lactose non-fermenters, or those that do not ferment, produce what we call clear, colorless colonies because they do not what? Ferment lactose. So you have what? A clear, colorless colonies. Clear, colorless colonies. So over here we have what? Achromic colony. Achromic means no color, or it means what? Colorless. It means colorless. And colorless, again, we are referring to what? To gram-negative what? Bacteria, And over here, we are looking at what? Salmonella, because salmonella do not ferment lactose. They do not ferment lactose. And hence, that is your answer. In E. coli, they will ferment lactose. This also means E. coli. Escherichia. Escherichia. It means E. coli. But this is not E. coli. Great. So your answer should be what? Should be salmonella. Salmonella. The person was selling homemade pork. Guys, yesterday we talked about what? Pork. We spoke about pork. We spoke about pork. And we said there's a question we're thinking of eosinophils. But because there was homemade pork or there was a pork or a pig in the question, immediately we started thinking of what? Trichinosis. Trichinosis. If you can remember yesterday's tutorials. Trichinosis. Great. So look at it. Person was selling homemade pork sausages on the market. State sanitary inspector suspected falsification of the sausages. With help of what serological immune reaction can food substances be identified? So again, the disease here is called what? Trichinosis. 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 And usually we do what we call a precipitation reaction. A precipitation reaction. Precipitation reaction. What does it do? It helps to determine what? The immunoglobulins level. Immunoglobulins. Immunoglobulins. Sorry. It helps to determine what? Immune globulins. Immune globulins present in the blood. Immunoglobulins. Immunoglobulins. So if there's presence of immunoglobulins, it means what? Infection is going on there. So that is what precipitation people or precipitation test does. That is what it does. And this again is specific for what? Trichinosis. Trichinosis. So here you are thinking of precipitation test. Precipitation test. So your answer is A. All right. While registering the child to the school Mantox test, again, Mantox is for what? Tuberculosis. And tuberculosis type what? Type 4 hypersensitivity. Good. Was made to define whether revaccination was needed test. Wait, so while registering the child to the school Mantox test was made to define whether revaccination was needed test result in negative. Okay. What does this result mean? What it means is that this person was tested negative for tuberculin test. Tuberculin test. So if it is negative, what does it mean? What does negative mean? What does negative mean? Again, Mantox test is a type 4 hypersensitivity what? Reaction. Type 4 hypersensitivity what? Reaction. So therefore, in type 4, it involves what? Cell mediation. It involves cell mediation. Cell mediation. So that's what immunity. Again, type 4 deals with immunity. It deals with T lymphocyte. I've told you countless number of times. So it deals with immunity. It deals with immunity. Good. So therefore, if the test result is negative, it means that there is no cell-mediated immunity in the tuberculosis. To the tuberculosis. There is no cell-mediated immunity. Again, if it's positive, it means what? There is what? A reaction. The cell is reacting on the antigen that is present. But it's negative, so it means that there is no immunity, cell immunity towards the tuberculosis. Towards the tuberculosis. Over here, what is your answer? Your answer is what? There's absence of cell immunity to the tuberculosis. There's absence. So your answer is A. All right. A donor who for a long time didn't donate the blood was investigated by the IFA method. Anti-hepatitis B antibodies were revealed. Anti-hepatitis hepatitis B antibodies were revealed. What does positive result of IFA in this case mean? What does it mean? What does it mean? So, of course, when they say anti-hepatitis B antibodies, it means what? Hepatitis B surface antibody. Hepatitis B surface antibody. Surface antibody. That's what it means. And the presence of anti-hepatitis B is interpreted as indicating what? Recovery. Recovery. There is what? Recovery. There's recovery and also what? There's immunity towards the B infection or towards the hepatitis B infection. Towards the hepatitis B infection. So, what does a positive test mean? So, positive test means that there was a previous hepatitis B. Previous hepatitis B, because the person is going through a recovery phase. Recovery phase. Why? Because there's anti-hepatitis B antibodies present. That means they're already reacting to the antigen, which is what? The hepatitis B. So here again, you are thinking of a previous Hep B infection. Previous Hep B infection. All right. Biological examination of a purulent discharge from the urethra revealed, guys, look, gram-negative bacteria looking like coffee beans. Please, a bacteria that looks like coffee bean is always gonorrhea. Always gonorrhea. If you go to heaven and come down, it will be gonorrhea, unless, of course, God himself decided to come down. But it is what? Gonorrhea. 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 So here you are looking at what? Diplococci, diplococci or diplococci, diplococci or diplococci. All right. And of course, it can cause meningitis and all those kind of things. But basically, your answer is what? Is gonorrhea. Gonorrhea. Scrapes of the mycelium of a fungus, spores and air bubbles and fat drops were discovered in a microscopy of the patient's hair, excluded from the infected areas. For what fungus disease is the microscopic picture characteristic of? So this person is having what we call the honeycomb. The person is having what? The honeycomb, whereby it affects the scalp. It affects the scalp, but of course, it can affect any part of the skin and even the mucous membranes. It can affect any part of the skin or even the mucous membrane. So over here, we are looking at at a honeycomb, or fungal infection on the scalp. Fungal infection on the scalp. And another name for the honeycomb is called what? Favus. Favus or favus. Favus or favus. Favus. All right. So here you are thinking of what? D. All right. They say in order to speed up healing of a wound of the oral mucosa, a patient was prescribed a drug that has a thermostable protein occurring in tears, saliva, and mother's milk, as well as in a low-laden hen's egg. In a new laden hen's egg, it is known that this protein is a factor of a natural resistance of an organism. Natural resistance of an organism. So first of all, you must know what are found in saliva, in the tears, and so on. So saliva and tears contain some antibacterial enzymes. Okay, they contain some antibacterial enzymes. No wonder they are what? Natural resistance. Natural resistance of an organism. In other words, what fights what? Diseases. Aha. Great. So in the saliva and in tears, they contain some antibacterial enzymes. Some of them include lysosome. And this would destroy any cellular wall of bacteria by destroying the peptidoglycan layer. Peptidoglycan layer. Peptidoglycan layer. So they destroy microorganisms. Destroy microorganisms. All right. So you can't find interleukin, interferons, and all these things in the tears or saliva of a patient. However, you can see what this antibacterial enzyme. So your answer is what? Lysozyme. All right. Guys, look at this question. Now they've brought the answer into the question. Look at it. Study of a bacteriological sputum specimen were stained by zilnersin. Zilnersin, you remember it. So we said zilnersin, we are dealing with what? Tuberculosis. As simple as that. So if you see this zilnersin, don't think double. And again, you see I was saying that we have what? Acid fast test. So the acid resistant what? Bacillus. Acid fast, they all mean the same thing. Acid what? Fast test. So the question is that what these bacteria relate to the following family? Definitely you're thinking of what? Tuberculosis. So the answer is E. Tuberculosis. All right. After a man was admitted to the hospital on the 5th day of the disease, that manifested itself by jaundice, muscle aching, chills, nose bleeding. In the course of lab diagnostic, a bacteriologist performed a dark field microscopy of the patient's blood drop. Name a causative agent of this disease. So, first of all, we're looking at what? A disease that has a CNS, not really CNS per se, but is able to cause a problem in the liver, problem in the muscles, causing bleeding, and so on and so forth. So usually we are talking about what? About the C and S kind of bacteria, also known as Leptospira. Now, these leptospirals interrogants, they cause leptospirosis, and these resemble the C and S that I was talking about. They circulate in the blood and multiply in various organs, producing fever, dysfunction of the liver, kidney problems, lungs problems, and even CNS problems. So these microorganisms have the tendency to destroy multiple organs. And that is why over here, we were stuck with the leptospirosis or Leptospira interrogans. Again, it destroys multiple organs. All right. Guys, look at this again. Now, the question is also the answer is not in the question. Look at it. Gram-negative bean-shaped Diplococcus or Diplococcus. You remember it? Yes. We said gonorrhea is what? Gram-negative what? Bean-shaped Diplococcus. We said this. So if you see this one, don't think twice. So your answer is what? It's Neisseria gonorrhea. Why? Because the microorganism is what? Gram-negative. This is beans. So it's a bean-shaped Diplococcus. So your answer is what? Is B. Don't think too much. Patient with diarrhea was admitted to the infections unit. Gram-negative curved rod-like were found on the microscopic examination of fecal masses. What is it? Rod shape. You are referring to what? Vibro-cholera. You are talking about vibro-cholera. They have what to call the comma shaped or a curved comma shape. So here you are thinking of what? Cholera. And again, they grow in the alkaline media. Alkaline media. They grow in alkaline media. So your answer is what? Is A. All right. A 2-year-old in a 2-year-old child with catarrh presentation and skin rash, a pediatrician suspected scarlet fever. Okay. This child was given intracutaneously small dose of serum antibody to the streptococcal erythrogenic toxin. On the site of infection, the rash disappeared. What do the reaction results mean? What do the reaction mean? Now, for the rash to disappear, it means that the antibody injected is specific for this toxin. Is specific for this streptococcal erythrogenic toxin, which means that it's positive, therefore confirming the diagnosis. So it has confirmed that when you give that injection, the microorganism causing it or the strep toxin causing it will disappear or they will die. So it is a clinical diagnosis. It means that clinical diagnosis was confirmed. Clinical diagnosis was confirmed. It was confirmed. So your answer is B. From the defecation of a 6-year-old child who has artificial feeding, the intestinal bacillus with antigen structure, look, 0, 111 is excreted. What is your diagnosis? What is your diagnosis? Now, this is antigenic structure of choleenteritis. Choleenteritis. This one, we don't teach it. You must know it. Choleenteritis. We don't teach it. You must know it. Because a structure, you must know how this is. All right. So your answer is E. For serological diagnosis of a whooping cough. So whooping cough, you're thinking about Bordetella pertussis, isn't it? Mm-hmm. Okay, was made large-scale reaction with, parapertussis and pertussis diagnosticum. At what bottom of the test tube would diagnosticum of Bordetella grain-like sediment formed? What antibodies have this reaction revealed? What antibodies have been revealed? What antibodies have been revealed? So first of all, you need to understand what is called agglutination, agglutins, agglutinogen. You need to know the difference between them. Okay, so I'll just take you through it a little bit. So when we talk about agglutination, like we did in how do you call it? ABO system or the Rhesus incompatibility system. Now, agglutination is a process which is based on the reaction of antigen. Now, antigen is also called what? Agglutinogen. So the same as what? Agglutinogen. Great. So antigen means what? Agglutinogen. So agglutination is a process whereby there's a reaction between an antigen and then an antibodies. Antigen and antibodies. And antibodies are called what? Agglutinins. Or agglutinins. Okay. So we have agglutinogen and agglutinins. This is what antigen, this is what antibody. When they react, it means they are not what? Compatible. And as a result, they lead to what we call what? Cramping of red blood cells. That's if it is with respect to red blood cells. Or clamping masses or clamped masses. Also called the agglutinate. The agglutinate. Great. Now, This test, where we have the parapertussis and the pertussis diagnosticum, these tests detect antibodies. They help in the detection of antibodies. I repeat, they help in the detection of what? Antibodies. Antibodies. So therefore, like I said, agglutinogen means what? Antigen. Agglutinins means what? Means antibodies. So over here, we are looking for what? Antibodies. 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 So the answer is what? Is A. Antibodies. 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 All right. Again, this is even easier. Man died from an acute infectious disease by fever. Guys, look at it. Fever, jaundice, rashes on the skin and the membranes, as well as renal insufficiency. We have what? Examination of the renal tubule revealed some convoluted bacteria looking like C and S. Again, C and S, you are thinking of what? Leptospirosis. Leptospirosis. And like I said, it affects a lot of what? Organs. But look at it. Fever is there, jaundice is there, rash is there, mucous membranes are there, even kidneys, they are there. So again, it's affecting a lot of what? Organs. So you're looking at what? Leptospirosis. Leptospirosis. So the answer is D. Is D. A 16-year-old boy from a countryside entered an educational establishment. Guys, look at it. Mantox test. Type 4, right? They said the Mantox test revealed that the boy had a negative reaction. Again, it means what? There is no immunity. There is no immunity. Because type 4 deals with immunity. So there's no reaction, it means there's no what? Immunity. So what is the most reasonable action in this case? What it means is that you need to vaccinate this guy because there's no immunity against this tuberculosis. Against the tuberculosis. So you do what? A vaccination. You vaccine the person against the tuberculosis. So therefore, what do? You perform a BCG vaccination. Perform a BCG vaccination. And then BCG simply means Bacillus galmet gorin. You don't need to know it. But it is what it is. So here your answer is what? Is A. Your answer is A. So here, do immunization with the BCG vaccine. The BCG vaccine.